AM 1220, KHTS, hometownstation.com. I am T. I'm with you every Thursday, noon to 1, here with Dr. Proctor. A chance to peek over the shoulders of the medical professionals to see what it is they're working on, things that affect us, our family. And in today's age, when there's so much knowledge out there, some of it a little scary. You know, I'm never a big fan of the armchair Dr. Google, because I feel like you can get information that's either going to be more confusing or maybe not completely clear. And the idea that we can come in and have a bit of a conversation with the doctors to demystify, maybe take a little of fear out of certain topics. Today we're talking with Dr. Thomas Kurian, who has a practice here in Santa Clarita on Lyons Avenue. He's an adult and pediatric neurologist. We're talking a little bit about traumatic brain injury resulting from the minor to the very, very serious. And we talked a little bit about what it is to... It's not just, I was always under the assumption for a very long life that it was a hit to the head, but it's really a blow, a violent blow or jolt to the body that can cause that wonderful little planet that sits in our skull to float and cause injury. We talked a bit about who's at risk, certainly veterans, people who have accidents, vehicular, job, home, sometimes violence, children, newborns to 4-year-olds, and then young adults, 15 to 24. For the elderly in a fall due to imbalance, interaction of medications, etc., athletes in sports, just the practice of what they're doing, and equipment failure. And Dr. Kurian, we talked a little bit during the break about the mindset that it's not just certainly not just the boys in the football and martial arts or boxing. There's a whole other group that we really should be concerned about.
No, that's true. When they look at the numbers, boys are a larger number of concussion patients. But when you look at girls compared to boys in sports that have similar rules, we actually find that girls are at a higher risk for developing concussions. We're looking into why that is. There's thoughts that maybe they have less musculature on their neck compared to boys. As a result, their head is more prone to whiplash injuries. There could be hormonal differences. It could also be that just the mass and the force applied to the individual is a little bit less. But either way, we're finding that girls are actually at a very significant risk for sustaining concussions. And so the idea that it's just the high school male football player that's the one who can suffer from it is something that we're learning is not true. And we're actually finding that it may be the high school cheerleader who's probably at a higher risk than we would think, because that field
some
hockey,
of the stunts
soccer,
and the tricks and
exactly.
And there was a concussion clinic done out here last year, and I had the opportunity to talk to some of the coaches and doctors, and they were very concerned about, certainly cheerleaders are tremendous risk, and they don't have a lot of the protective gear. But another sport I had not thought of, because I think of it as a pretty mellow sport until I watched a little bit of it, is girls soccer. It's
a pretty demanding and physical sport. There's no reason to think that girls don't go just as hard as guys do when it comes to that sport there. And they are doing headers, they are running into each other. There are people trying to jump up and kick the ball, which can backfire and sometimes
foot in the head.
Exactly,
Yeah.
take a cleat to the head. So,
but I had never thought of it. I mean, you go to your local pancake restaurant on a Saturday or Sunday, and they're there in their cute little outfits and matching little hair braids, and it's like, you girls that's a very serious and kind of scary, some scary moments on the field.
Exactly, and so we just want parents and family members to realize that it's just not your boys that are at risk. You have to look at your girls too and see if they maybe suffered from something and maybe need to get checked out also. And
just again, that whole making sure that they are assessed if they come off the field and they're a little altered or they're not themselves is really what you're looking for. It's like that crazy candy bar commercial. You're not yourself when you're hungry.
Exactly.
You're not yourself when you sustain a head injury.
That's very true.
And the family really needs to be aware of that and speak up.
And it's also really important for them to be the advocate for the patient. Coaches are great. They're there, and sometimes their attention's going to be split amongst the number of players on the field, you know.
Well, what do they have? They've got 20, 30 kids.
Exactly.
And you know your kid. Nobody knows your kid like you know your
Exactly.
kid.
And so, one of the things that we find is great, and we do encourage parents to be doing this, is videotape your kids' games in case there is something.
That's brilliant.
So that way we can actually see the mechanism of the injury. What did they look like in the seconds that happened afterwards? Were they, stumbling around? How long did it take them to get up? What did they seem like? Those types of things will help us determine, like, okay, you know what? There was not just a possible or probable concussion. There probably is a definitive concussion there.
That's actually really good advice. And the idea that you can actually possibly catch the injury to see what it was.
Exactly. And then from there, the reason that that's important is allowing us to figure out, okay, there was a definitive concussion. We need to institute these, what we call these return to play guidelines. The Hart School District's really great. They're trying to be really proactive. A lot of the coaches over at Valencia are taking a lead on that and trying to get some guidelines set into play with the entire school district on what we need to do in order to make sure a kid's safe to come back and play sports after possible concussions.
I like that. Let's talk a little bit about complications. Once you've got a patient who's had this altered consciousness, there are a lot of things, and this is what you're looking for. And again, thank you for buying the books and going to school to be the guy to look for this. There are terrible complications that can come from a head injury. Again, we're talking about traumatic brain injury, anything from relatively minor to incredibly serious. But in addition to just consciousness being altered, seizures, fluid buildup, infections, which I'd not thought of, blood vessel damage, nerve damage, intellectual long-term problems, communication, behavioral, emotional, sensory issues, and degenerative brain diseases. These are all really very serious. And one reason why, if someone takes that injury and has that accident or that problem, that we see or the neurologist to go in and start dealing with that. But when it comes to treatment, let's talk about first just the minor head injury or brain injury where someone's taken that blow to the head. Maybe mom's tripped on that last stair coming for holiday dinner, or the kids were jumping on the bed. And okay, so now we have the minor. Walk me through some of the treatment for this.
Really, it's going to be a lot of the same things across the whole spectrum of it, just depending on what symptoms they're presenting with. The first thing that we really tell people to do is you give them 1 or 2 days to maybe just rest and relax. After that...
And watch them.
But you definitely don't want to allow them to just sit in a dark, quiet room forever until their symptoms go away, because we're actually finding that delays their recovery. So maybe give them some time to rest, a day or two at most, then really start to do the entire graduated return to play and also study and day-to-day activity guidelines, where you give them maybe 10, 15 minutes of doing something, just some light activity, reading a book, walking around the block, things of that nature, see what they're capable of doing. And then the next day, if there's no symptoms at all, like the headaches are better, things are okay, push them a little bit more, have them do 30, 40 minutes, see how things are going. It's really about trying to get them back, but not going too quickly, not pushing them too hard, allowing them to say, okay, I'm starting to get symptoms, I'm starting to get dizzy again, I'm starting to get nauseous, the headache's coming back, you need to stop, take a break.
Dial it back.
That's the new baseline. That's the new, okay, this is the most that we can do. Tomorrow we're going to try to get there and maybe go back. But they need to stop, rest, take that time out and allow themselves to heal before we push them to go further from there. And then in terms of, headache treatments and things of that nature, initially when the injury occurs, just over-the-counter stuff is okay. Now, we always have to make sure we're not overusing those things. Once we start getting into too much Tylenol,
because then you lose your symptoms. You don't know that you're having the headache, right?
Well, it's not even that. Yes, that definitely is something, but we also found that overuse of Tylenol, Motrin, Aleve, those things can cause headaches. And none of these medicines are benign medications. There's no such thing as a benign medicine. Even Tylenol and Motrin have side effects. These things can affect your liver, your stomach, some of these medications can affect your platelets, so they're not to be taken lightly. These are things that
Good advice, by the way. Thank you for that.
No,
It's very
no
good
problem.
advice, because a lot of people, reach for the bottle, and sometimes that's not necessarily the right thing to do.
No, definitely. You want to make sure that if you're taking these things, you really need to be taking these things. If you can manage to do without it, try your best. Your body's really going to be able to cope with a lot of things. But when we start putting things in there, we have to make sure we're doing it for the right reasons, and
good.
that we absolutely need to be doing
Absolutely.
those things. And then, if symptoms do start to persist for longer than, say, 2 to 4 weeks, if there's headaches that keep going on, dizziness that keeps going on, that just won't get better, that's when we need to evaluate them in the office, see exactly what's going on. Because, one of the things we're finding out is that maybe it isn't just a concussion. Maybe we had a headache history that we just really didn't know too much about. Maybe someone did suffer from migraines,
Right.
and then these are just migraines, and maybe we need to tailor our treatment more to treating just the migraines.
Again, looking at the patient, not what's on the paper, not
Exactly.
the
It's treating the
test.
patient, not the test results, lab results, asking them actually, okay, were you dizzy before the injury? Yeah, I kind of was. I didn't realize it, but now that I look back, yes, it is.
Wow.
All right, maybe we need to treat your dizziness more than, okay, going after all these weird concussion symptoms,
Right.
and maybe we can get you a little bit better. So
Right.
it's really kind of figuring out what was there before, what's brand new, what do we do to treat those new symptoms, and maybe even treating the underlying condition is necessary too.
So depending on the severity, then medications come into play, perhaps, and afterwards, one of the things that had, for me, was a revelation to know that this is where your post-care rehabilitation people come into play. Those going to school and learning at the moment, what's next. Psychiatry, occupational therapy, speech or language, working with a social worker or case manager. I mean, there's a tremendous team that becomes involved that are the great caregivers to help patients through that next place. And so if someone in your family, again, whether it's the athlete, the elderly, a child, someone who'd been involved in some type of accident, or a veteran, the idea that therapies become a great part of that treatment. When you work with patients and you take them on to that next level, what does that look like for someone who, let's because we're kind of concentrating a little bit on the athlete again with the film that's coming out in December. Concussion's going to talk a lot about athletes and traumatic brain injury. So let's kind of narrow down, what does that look like for the athlete who's sustained a relatively an impactful brain injury? What does that look like for you and your patients when treatment becomes an issue? How long can that sometimes go?
It goes on until the symptoms are done. There's no set guidelines that say, okay, patient A will have symptoms.
6 months, 8 months.
Exactly.
It's just all on the patient.
It's all on the patient. Everyone is going to be different. 85% of people get better in 2 to 4 weeks, but that still leaves us 15%. And those 15%, there's no way for us to know exactly how much longer your symptoms are going to be there. And we're going to continue to treat those as long as they're there. Now, we as doctors wish that we could be there every day for our patients and take care of every issue, but unfortunately we can't. So it really comes down to parents being a huge support system, family members being a support system, especially in kids. I'm finding that a lot of the school systems, we're really lucky in the sense that I feel like the Hart School District is actually taking a very proactive role in helping with the kids out here. I haven't seen a single teacher or counselor that hasn't been sympathetic to a patient with a concussion, and they've really kind of allowed them to make accommodations and things like that. And that's important too,
Yes,
because
yes.
we need to give these kids rest, not just from physical activity, but also mental activity.
They have to heal.
They do, and there's some scales that we do, like the sports concussion assessment tool. Some of the questions are like, do you get these symptoms when you are physically active? Do you get these symptoms when you have mental activity? And so allowing these kids to also not just gradually get back into, their practice routine, but also their school routines are very important. So it's important for us to work with teachers and counselors to do that. Now, for the athletes, definitely our trainers and coaches are going to be our biggest asset there. They're going to be the ones that know what the the athlete was doing or how they were performing before the injury. They're going to be the ones that know, okay, look, we have a graduated return to play. Let's get you on the treadmill walking, see how you're doing. Okay, you're doing great. Let's get you running. Okay, let's get you weightlifting. They're going to be the ones that really help kind of institute that return to play. They're going to be the guardians that say, okay, you had enough, let's get you out and rest. So.
And this is so critically important because for a long time, that was not the way it was. It was the kid just shake it off, go back to normal, and it was out of sight, out of mind, we're moving forward. And now you, along with your colleagues and your peers in your field, are seeing that, we need to kind of finesse this a little more to make sure that the long-term gains are better than the short-term get back in the game and do what needs to be done.
Exactly.
So.
We have to look at this as a long-term injury. We can't look at this like a broken bone that's going to get better in 6 months. Even broken bones, they're weaker than the original one, and it's going to be easier to fracture that bone later on. The brain is exactly the same way. We notice that every subsequent concussion makes the next one easier to get, could become more severe, last longer. So we need to be cognizant of how many concussions a patient's had, and as they get up, usually for me, I'm recommending major changes around the third concussion. Even second ones, I'm like, look, we need to take a careful look at what you're doing, how much
Doctor,
do you want to be doing.
it hurts when I'm doing this.
Yeah.
All right, stop doing that.
Exactly.
So in regards to prevention, there's a few things that patients can, or just in the general public, should be aware of. Let's say if it is the elderly or children, the environment, the home, the entry, the layout, things that can be an issue. Seatbelts and airbags, certainly for someone, that's pretty standard for the most part, but still something to be considered. Appropriate sports gear, and again, talking about our soccer player girls or our cheerleaders, that I wonder if that's something, do you see that? I mean, I don't know that even I was going to say the Los Angeles Lakers and their cheerleaders, are they going to start wearing helmets? Can we make that a thing?
I don't know if they're going to sell too many tickets if they're doing that.
But the practice itself, we might want to start taking a look at.
I mean, we definitely need to try to make sure that we minimize the risk.
Right.
So, it would be great if, our cheerleaders can practice on mats, but a lot of times they're out there on the field practicing these things, and we can't keep those things out.
And some of the routines they do, I'm telling you, I watch them and go, what is happening right now?
Yeah.
How are they doing that? And one small, hiccup, and I feel like somebody's getting hurt. I worry about that.
And, we don't want to ever limit our patients or our players really in what they can do, because we want them to be able to achieve the maximum of what they can do. So that means they're going to have to push themselves and try some things that may be a little dangerous, but we also have to take our steps to make sure we're protecting them throughout every stage of that, and really pray for the best.
Yes,
I think
absolutely.
something that we're learning nowadays also is really interesting at a concussion conference we went to recently. Not all helmets are created the same. They're finding that a lot of helmets out there don't do as well as some other ones. So I think it's really important for coaches and equipment managers to make sure that each player is wearing appropriate gear for them. And as far as I know, there isn't a set guidelines or rating scales for helmets, in terms of concussion prevention. They're definitely trying to work on those things, but once that comes out, it'll be important for us to make sure we equip our kids with the safest equipment to protect them.
And as we were saying, it's not just, again, my mythology was always, it's a blow to the head. It's not. It's a blow or jolt to the body, even that can cause a mild to very serious traumatic brain injury. Dr. Kurian, thank you for taking time out of your schedule. I am in awe of what you do, of what you've studied. Every doctor that comes through here, I truly have great respect for that, and the idea that you've taken time to come and help educate and speak on this subject. I am grateful again for your ability to be here on the show and literally sit across the desk and just have a conversation about something that affects each and every one of us. So many people possibly at risk for traumatic brain injury. Again, we've been talking with Dr. Thomas Kurian. He is a board-certified adult and pediatric neurologist. He has a practice here in the Santa Clarita Valley. If you're interested, he's on Lion Lyons Avenue, and we've been talking about traumatic brain injury. Every week here on Dr. Proctor, we pick a different subject. Again, the opportunity to peek over the shoulders of our medical professionals, our doctors, our nurses, our therapists, the people that help us throughout each and every stage of our lives or our loved ones' lives, but the opportunity to give us the idea that we can go in and at least have the conversation with our doctors and with our medical professionals when incidences arise, such as traumatic brain injury. We've covered a lot of ground, Dr. Kurian. Thank you for going through all of this. So happy that you're one of the docs in the community keeping an eye on certainly our young people in the sports field and represent, heart. I love that you're a graduate from the Valley. So again, thank you for your time and your expertise.
Thank you for having me.
All right. When we return from our break, we'll talk a little bit, just a bit of wrap up. But you're listening to Dr. Proctor every Thursday, noon to 1, here on your hometown station, AM 1220 KHTS. We will be back after this. AM 1220 KHTS, hometownstation.com. I am T. Every week I'm here with Dr. Proctor, a show noon to 1, which is an opportunity, again, to peek over the shoulders of medical professionals who are basically out there still every day learning on our behalf, changes that come along in the medical community. And I truly believe that we as people are still probably in the process of evolving a little bit. They're learning a lot about us that maybe they didn't know before, and we're learning things about us. With all the changes that are happening in the medical industry and people having more access to healthcare, doctors and hospitals are so tremendously impacted right now that the idea that we can learn even a little bit about our optimum health and taking care of ourselves and our loved ones, to go to the doctors when we really need to see them. And today I had the good fortune to speak with Dr. Kurian, Dr. Thomas Kurian. He's a board-certified adult and pediatric neurologist who has a practice dealing a lot with traumatic brain injury, where I had said to him, I was always under the impression for most of my life that something like a concussion or traumatic brain injury came from a blow to the head. And it's actually not true. A violent blow or jolt to the body can it can cause an injury ranging from anything that's just mild, which is a little bit of temporary dysfunction and to be expected when that happens, to very serious, perhaps long-term concussions or injury or even a fatality. And as Dr. Kurian said, there's a lot we can do to take care of ourselves. We basically have to watch our loved ones. We have to make sure that we give them an opportunity to show us what is happening insofar as their injury is concerned. And yes, someone, if they're going to have a mild injury, they're going to show signs of a headache or perhaps nausea, as he mentioned, and maybe a little dysfunction in their balance. But it's not necessarily that moment where we go to the doctor. We keep an eye on our loved one and see if the next step is to go find out if it's an even more serious brain injury. We talked a bit about the idea that prevention, certainly with our older loved ones and our children, newborn to 4-year-olds, young adults 15 to 24, the environment, home entry, layout, child-proofing, all the things to prevent these injuries. When it comes to accidents, vehicular, making sure we have seat belts and airbags. We have appropriate sports gear for our athletes, because injuries can come from not just the sport or the practice, but even equipment failure can be the problem. Again, if you ever have any questions, we always encourage you call your doctor, and we hope you will tune in on Thursdays, again, to learn a little and perhaps find out what more we can do for ourselves. This has been Dr. Proctor here on your hometown station, AM 1220 KHTS.